The journey through cancer treatment is often challenging. Many people seek ways to support their body's healing, and natural approaches can play a significant role when used alongside conventional medical treatments. This is known as integrative oncology. It aims to combine the best of both worlds. Conventional treatments like chemotherapy, radiation, and surgery are primary tools to fight cancer directly. Natural therapies, on the other hand, focus on strengthening the body, mind, and spirit. They can help manage side effects, improve quality of life, and support overall well-being during this demanding period, fostering a more comprehensive path to recovery. And open and honest communication with your oncology team is extremely important. Before starting any natural therapy or supplement, discuss it with your doctors. This ensures that the chosen approaches are safe for your specific situation. Some natural substances can interact with conventional treatments, potentially reducing their effectiveness or increasing side effects. Building a collaborative relationship with your healthcare providers allows for a well-rounded and safe treatment plan. This team approach ensures that all aspects of your health are considered, and that complementary therapies truly support the primary medical interventions you are undergoing rather than interfering with them. Natural approaches work by supporting the body's innate healing mechanisms, and our bodies possess a remarkable ability to heal and restore balance. Therapies like dietary changes, specific exercises, and stress reduction techniques can bolster these natural defenses. They can help strengthen the immune system, which plays a vital role in identifying and fighting abnormal cells. Furthermore, many natural methods help reduce inflammation throughout the body. Chronic inflammation is increasingly recognized as a factor that can contribute to cancer development and progression. And by nurturing these inherent healing capacities, we create a more favorable internal environment for recovery and health. Embarking on a path that includes natural therapies can be incredibly empowering for patients, because facing a cancer diagnosis can often make individuals feel a loss of control. By actively participating in choices about diet, lifestyle, and complementary care, patients can reclaim a sense of agency over their health journey. This proactive involvement can significantly boost morale and instill a sense of hope. Natural therapies offer numerous avenues for self-care, helping to build resilience against the physical and emotional stresses of cancer and its treatment. Nutrition plays an absolutely foundational role in supporting health, especially during cancer treatment. The foods we consume provide the essential building blocks our bodies need for energy, repair, and immune function. Think of food as a form of medicine, capable of nurturing your body from the inside out. It is particularly important to focus on a diet that minimizes substances that can tax the system. This means consciously avoiding or significantly reducing the intake of heavily processed foods, refined sugars, and unhealthy fats, because these items can often contribute to inflammation and provide little nutritional value, which is counterproductive when your body needs optimal support for healing and recovery. The cornerstone of a supportive diet is an emphasis on whole, unprocessed foods. These are foods that are as close to their natural state as possible. This includes an abundance of fresh fruits and vegetables, which are packed with vitamins, minerals, and protective plant compounds. Whole grains such as brown rice, quinoa, oats, and whole wheat bread provide sustained energy and valuable fiber. Legumes, including beans, lentils, and chickpeas, offer an excellent source of plant-based protein and fiber, contributing to satiety and digestive health. By choosing these wholesome options, you provide your body with a rich spectrum of nutrients essential for its daily functions and for coping with the demands of treatment. Whenever possible, choosing organic foods can offer additional benefits. Organic farming practices avoid the use of synthetic pesticides, herbicides, and genetically modified organisms, and this reduces your exposure to potentially harmful chemical residues, which is particularly relevant when your body and immune system may be more vulnerable. Beyond personal health, opting for organic supports agricultural methods that are more sustainable and kinder to the environment. While organic options might sometimes be more expensive or harder to find, prioritizing them for certain types of produce known as the dirty dozen can be a practical approach. The goal is to ensure the food you eat is as pure and nutrient-dense as it can be, and a simple yet powerful guideline for ensuring a nutrient-rich diet is to eat the rainbow. This means incorporating a wide variety of colorful fruits and vegetables into your daily meals. Different colors in plant foods typically indicate the presence of different phytonutrients. These are natural compounds that have antioxidant and anti-inflammatory properties. For example, red foods like tomatoes contain lycopene, orange foods like carrots offer beta-carotene, and dark leafy greens are rich in lutein and folate. By consuming a diverse palette of these foods, you ensure your body receives a broad array of protective substances that help shield cells from damage and support overall vitality. Certain groups of vegetables are particularly noteworthy for their health-promoting properties. Cruciferous vegetables, for instance, are a powerhouse of nutrients. This family includes broccoli, cauliflower, kale, Brussels sprouts, cabbage, and bok choy. They are rich in glucosinolates, which break down into compounds like sulforaphane and indole-3-carbinol during digestion. These substances have been studied for their potential to support the body's natural detoxification pathways. They may also play a role in inhibiting the growth of certain cancer cells and promoting cellular health. Including a regular serving of these versatile vegetables, whether steamed, roasted, or in salads, can be a beneficial dietary strategy. Berries and other deeply colored fruits are exceptional sources of antioxidants. Blueberries, raspberries, strawberries, and blackberries are packed with compounds called anthocyanins, which give them their vibrant hues. These, along with other phytonutrients like ellagic acid, help combat oxidative stress in the body. Oxidative stress is an imbalance between free radicals and antioxidants, which can damage cells, including DNA, and contribute to chronic diseases. Pomegranates are another fruit celebrated for their high antioxidant content. Enjoying a variety of these delicious fruits as snacks, in smoothies, or as part of your breakfast can provide significant protective benefits for your cells and overall health. Incorporating healthy fats and sufficient lean protein is also vital for a supportive diet. Omega-3 fatty acids found in fatty fish like salmon and mackerel, as well as in plant sources like flax seeds, chia seeds, and walnuts, are renowned for their anti-inflammatory effects. These fats are essential for brain health, cellular structure, and reducing systemic inflammation. Lean proteins are crucial for tissue repair, immune function, and maintaining muscle mass, which can sometimes be affected by cancer treatments. Good sources include poultry, fish, eggs, beans, lentils, and tofu. Ensuring adequate intake of both healthy fats and lean protein supports your body's strength and resilience. Finally, the importance of adequate hydration cannot be overstated. Water is essential for nearly every bodily function. It aids in the digestion and absorption of nutrients, helps flush out waste products and toxins, and regulates body temperature. It also plays a key role in transporting nutrients and oxygen to cells, which is critical for energy and healing. Aim to drink plenty of plain water throughout the day. Herbal teas such as ginger or peppermint tea can also contribute to your fluid intake and may offer additional soothing benefits. It is wise to limit sugary drinks, sodas, and excessive amounts of caffeine, as these can be dehydrating and offer little nutritional value. Regular physical activity can be an incredibly powerful tool for individuals undergoing and recovering from cancer treatment. Exercise often helps to counteract some of the most common and debilitating side effects, such as persistent fatigue. It can significantly improve physical strength, endurance, and flexibility, which may decline during periods of illness and treatment. Beyond the physical benefits, movement has a profound positive impact on mental health. It can elevate mood, reduce feelings of anxiety and depression, and promote a greater sense of overall well-being. It's important to remember that the goal isn't necessarily intense athletic training, but rather consistent, moderate activity tailored to your capabilities. There are many types of exercise that can be beneficial and enjoyable. Gentle activities such as daily walking, swimming, or cycling are excellent choices, especially when starting out or if energy levels are low. These low-impact exercises help improve cardiovascular health without putting excessive strain on the joints. Mind-body practices like yoga and Tai Chi are also highly recommended. They combine gentle movements with deep breathing and mindfulness, which not only enhances flexibility and balance, but also provides significant stress reduction. The key is to choose activities that you find pleasant, and that can be adapted to your current physical condition and energy reserves. The benefits of exercise extend to supporting the immune system. Physical activity can improve the circulation of immune cells throughout the body, potentially enhancing their ability to detect and deal with threats. Regular movement also helps to reduce chronic inflammation, which, as mentioned earlier, is linked to cancer development and other health issues. Furthermore, maintaining a healthy body weight is an important factor in both cancer prevention and reducing the risk of recurrence. Exercise, in conjunction with a healthy diet, plays a crucial role in weight management. These combined effects contribute to a stronger, more resilient internal environment. When incorporating exercise into your routine, it's crucial to start slowly and listen carefully to your body. Pushing too hard, especially when dealing with treatment side effects, can be counterproductive. It is always advisable to consult with your doctor or a qualified physiotherapist before beginning any new exercise program. They can help you determine safe and appropriate activities based on your specific health situation. Remember that consistency is more important than intensity. Even short periods of gentle movement done regularly can yield significant benefits. Finding activities that you genuinely enjoy will make it much easier to stay motivated and make exercise a sustainable part of your life. Calming the storm: stress management for mind and body resilience during treatment. The experience of a cancer diagnosis and its subsequent treatment can understandably bring about significant stress. Chronic stress, however, can have a detrimental impact on overall health. When the body is constantly in a state of high alert, it can weaken the immune system, making it less effective at its crucial tasks. Prolonged stress may also create an internal physiological environment that is less conducive to healing and recovery. The connection between the mind and body is profound and very real. What affects one will invariably affect the other. Therefore, actively managing stress is not a luxury but a vital component of comprehensive cancer care and support. Meditation is a widely recognized and highly effective technique for reducing stress and promoting a sense of calm. There are various forms of meditation, but many, like mindfulness meditation, involve focusing your attention on the present moment, often on your breath, without judgment. Guided imagery is another practice where you create calming and positive mental images. These techniques help to quiet the mind, slow down racing thoughts, and activate the body's relaxation response. This, in turn, calms the sympathetic nervous system, which is responsible for the fight or flight stress reaction. Even dedicating just 10 to 15 minutes each day to meditation can make a noticeable difference in stress levels and emotional well-being. Yoga offers a wonderful combination of benefits, addressing both physical tension and mental stress. This ancient practice integrates gentle physical postures, controlled breathing exercises, and meditation or relaxation techniques. The postures help to improve flexibility, release muscle tightness, and enhance body awareness. The breathing practices calm the nervous system and increase oxygen flow. Together, these elements work synergistically to reduce stress, alleviate anxiety, and foster a deep sense of inner peace and balance. There are many different styles of yoga, from very gentle restorative practices to more active forms, allowing individuals to find a style that suits their current needs and physical abilities. Beyond meditation and yoga, there are numerous other simple yet effective practices for managing stress. Deep breathing exercises, for example, can be done anywhere and at any time to quickly reduce feelings of tension. Spending time in nature, whether it's a walk in a park or simply sitting in a garden, has been shown to have a calming effect on the mind. Listening to soothing music or engaging in enjoyable hobbies can provide a welcome distraction and promote relaxation. Furthermore, the importance of emotional support cannot be overstated. Sharing your feelings with trusted loved ones, friends, or joining a support group can significantly lighten the emotional burden and foster a sense of connection. Nature's Pharmacy, exploring supportive herbs in integrative cancer care. Herbal medicine has been used for centuries across various cultures to support health and treat illness. In the context of modern cancer care, herbs are generally considered as supportive agents rather than standalone cures. Their role is to complement conventional treatments by helping to strengthen the body, alleviate side effects, or enhance overall well-being. It is crucial to approach herbal remedies with caution and always under the guidance of a healthcare professional knowledgeable in their use, such as a naturopathic doctor or an herbalist working in conjunction with your oncologist. This is because some herbs can interact with medications including chemotherapy drugs, so expert advice is essential for safety. Turmeric, and its bright yellow active compound curcumin, has garnered significant attention for its potent health properties. Curcumin is well known for its strong anti-inflammatory and antioxidant effects. Inflammation and oxidative stress are processes that can contribute to cancer development and progression. Laboratory and animal studies have explored curcumin's potential to interfere with various molecular pathways involved in cancer cell growth and survival. While more human research is needed, incorporating turmeric into the diet, often with a pinch of black pepper, which contains piperine to enhance curcumin absorption, or considering a standardized curcumin supplement after medical consultation, may offer supportive benefits. Green tea is another natural substance rich in health-promoting compounds. It is particularly abundant in polyphenols, a type of antioxidant, with epigallocatechin gallate, EGCG, being the most researched. EGCG has demonstrated powerful antioxidant capabilities, helping to protect cells from damage caused by free radicals. Numerous studies have investigated the potential of green tea and its extracts to inhibit the growth of cancer cells and to interfere with angiogenesis, the process by which tumors develop new blood vessels to support their growth. Enjoying a few cups of high-quality green tea daily is a simple and generally safe way to incorporate these beneficial compounds into your routine. Astragalus root is a prominent herb in traditional Chinese medicine, where it has long been valued for its immune-boosting properties. It is often referred to as an adaptogen, meaning it may help the body adapt to stress and resist disease. In the context of cancer care, astragalus is sometimes used to help support the immune system, particularly for individuals undergoing chemotherapy or radiation. Some research suggests it may help protect the body from some of the suppressive effects these treatments can have on immune function and blood counts. Astragalus is typically used as part of a broader herbal formula and should only be taken following professional advice. Essential allies: understanding vitamins, minerals, and supplements for immune strength. Specific vitamins play a critical role in maintaining a robust immune system, which is your body's primary defense mechanism. Vitamin D, often called the sunshine vitamin, is increasingly recognized for its importance in immune regulation. Low levels of vitamin D have been linked to an increased risk of various health problems, and some research suggests a connection between adequate vitamin D status and better outcomes in certain cancers. It is advisable to have your vitamin D levels checked by your doctor, who can recommend appropriate supplementation if needed. Vitamin C is another well-known immune supporter, acting as a powerful antioxidant and contributing to the function of various immune cells. Essential minerals are also indispensable for optimal health and immune function. Zinc, for example, is crucial for the normal development and function of immune cells, including neutrophils and natural killer cells. It also plays a vital role in wound healing and DNA synthesis. Selenium is another important trace mineral that possesses antioxidant properties and supports thyroid function, which indirectly influences overall metabolism and energy levels. While a balanced diet should provide these minerals, certain conditions or treatments might increase the need for them. Ensuring adequate intake through nutrient-rich foods, or if necessary and recommended by a healthcare provider, through supplementation is key. Omega-3 fatty acid supplements, typically derived from fish oil or algae sources for vegetarians, can offer significant anti-inflammatory benefits that go beyond what might be achieved through diet alone. Chronic inflammation can undermine the body's healing processes and contribute to disease progression. The omega-3s, EPA, and DHA have been extensively studied for their ability to reduce inflammatory markers. There is also some research into their potential role in supporting cancer treatment effectiveness and helping to reduce cancer-related cachexia, which is severe muscle wasting. When considering omega-3 supplements, it is important to choose high-quality products and discuss appropriate dosages with your doctor. The health of your gut microbiome, the trillions of bacteria and other microorganisms living in your digestive tract, is profoundly linked to your immune system. In fact, a large portion of your immune system resides in the gut. Cancer treatments like chemotherapy and antibiotics can unfortunately disrupt the delicate balance of gut flora. Probiotics are live beneficial bacteria that, when consumed in adequate amounts, can help restore this balance. They may support digestive health, reduce certain treatment side effects like diarrhea, and potentially enhance the immune response. Probiotics can be found in fermented foods like yogurt, kefir, sauerkraut, and kimchi, or taken as supplements, always after consultation with your healthcare team. Beyond the conventional, exploring complementary therapies such as acupuncture and massage. Complementary therapies are distinct from alternative medicine. Alternative medicine is used instead of conventional medical treatments, whereas complementary therapies are used alongside them. The primary goal of complementary approaches is to enhance overall well-being, help manage symptoms associated with cancer and its treatment, reduce stress, and improve quality of life. They address the person as a whole mind, body, and spirit, and can be an invaluable part of an integrative cancer care plan. These therapies empower individuals to take an active role in their healing journey, focusing on comfort and support throughout the treatment process and beyond. Acupuncture is an ancient practice originating from traditional Chinese medicine. It involves the insertion of very fine, sterile needles into specific points on the body, known as acupoints. According to traditional theory, this helps to rebalance the flow of vital energy, or qi, pronounced qi, throughout the body. From a Western medical perspective, acupuncture is thought to stimulate nerves, muscles, and connective tissue, potentially leading to the release of endorphins, the body's natural painkillers, and other neurochemicals. Many cancer patients find acupuncture helpful for managing a variety of symptoms, including nausea and vomiting from chemotherapy, pain, fatigue, hot flashes, and dry mouth. Massage therapy, when performed by a therapist experienced in working with cancer patients, can provide significant comfort and relief. Gentle massage techniques can help to reduce anxiety, alleviate muscle tension and pain, and combat fatigue. Many people report improved sleep and a greater sense of relaxation and well-being following a massage session. It is important to choose an oncology massage therapist who understands the precautions needed for cancer patients, such as avoiding direct pressure on tumor sites or areas affected by lymphedema, and adjusting techniques based on treatment side effects like low blood counts. Lymphatic drainage massage is a specialized form that can be helpful for managing lymphedema. Other complementary approaches like aromatherapy and expressive arts therapies can also play a supportive role. Aromatherapy involves using essential oils extracted from plants to promote psychological and physical well-being. Scents like lavender, chamomile, and peppermint may help to reduce stress, improve mood, and alleviate nausea when inhaled or used in a diffuser. Expressive arts, such as art therapy, music therapy, or journaling, provide creative outlets for processing emotions, reducing anxiety, and finding solace and meaning during a challenging time. These therapies acknowledge and address the important emotional and spiritual dimensions of healing, contributing to a more holistic sense of care. Embracing wholeness, the path to holistic health and sustained well-being. As we draw this discussion to a close, it is vital to reiterate the profound value of a holistic approach to health and healing, especially when facing cancer. This perspective recognizes that the mind, body, and spirit are deeply interconnected, and that true well-being arises when all these aspects are nurtured. The journey through cancer is not solely about fighting a disease, it is also an opportunity to cultivate a deeper understanding of health, to make conscious choices that support vitality, and to foster resilience from within. Integrating natural, supportive therapies alongside conventional medical care allows for a more comprehensive and personalized path toward recovery and long-term wellness. The importance of a strong and compassionate support system cannot be overemphasized during such a significant life challenge. Leaning on family, friends, and support groups can make a tremendous difference. Sharing your experiences, fears, and hopes with others who understand or are going through similar situations can lessen feelings of isolation and reduce emotional burdens. The healing power of human connection and community provides strength and comfort. Do not hesitate to ask for help when you need it, whether it's practical assistance, a listening ear, or emotional understanding. This network of support is a crucial pillar of holistic care. A cancer diagnosis, while incredibly difficult, can sometimes lead to a profound shift in perspective, prompting individuals to reevaluate their priorities and focus on what truly matters in life. This period may inspire a search for deeper meaning and purpose. Engaging in activities that bring joy, fulfillment, and a sense of connection can be incredibly therapeutic. Whether it's spending more time with loved ones, pursuing a passion, connecting with nature, or engaging in spiritual practices, these pursuits nourish the soul and contribute to inner strength. This internal fortitude is an often underestimated yet powerful component of the healing process. Ultimately, embracing natural approaches in conjunction with conventional treatment is about empowerment and fostering hope. These strategies offer practical tools and pathways for individuals to actively participate in their own healing and well-being. By making informed choices about diet, exercise, stress management, and complementary therapies, patients can enhance their body's innate capacity for healing and improve their quality of life. This journey is one of cultivating resilience, nurturing the whole self, and looking towards a future characterized by sustained health, vitality, and a renewed appreciation for the profound strength inherent within each of us.